Hello and welcome back to Thriving Nurse. Today we are going to go over ventricular septal defects that you may find in infants, newborns, NICU babies, all of that. So right here we have our two ventricles, our right and left ventricle, and this is considered our septum. And right here we have an opening, and that is what is going to be considered as our VSD. So let's get started on VSD. Definition: ventricular septal defect characterized by a hole in the septum that separates the two lower chambers, the ventricles, of the heart. The defect allows blood flow from the left ventricle to the right ventricle, which can increase blood flow to the lungs. Prevalence: VSDs are one of the most common congenital heart defects, accounting for approximately 20 to 30% of all cases. They can occur as isolated defects or in conjunction with other heart abnormalities. Types. The first you may see is muscular VSD, which is located in the muscular part of the septum. These can vary in size and may close on their own as the child grows. Second one you may see is perimembranous VSD, which is located near the heart's valves. This type is more common and may be associated with other heart problems. Symptoms. Some symptoms in infants and newborns can vary widely depending on the size of the defect and the amount of blood flow it causes. Some common symptoms include 1. Rapid breathing, which would have an increased respiratory rate due to the blood flow going to the lungs. Number 2, poor feeding, difficulty feeding or tiring during feeding times leading to poor weight gain. Fatigue, lethargy or decreased level of activity. Number 4, sweating, excessive sweating during feeding or exertion. Number 5, frequent respiratory infections and increased vulnerability to lung infections due to elevated flow of blood to the lungs. Diagnosis. VSDs are commonly diagnosed using an echocardiogram, chest x-ray, electrocardiogram, ECG, and you can read right here what those all are. Impact on growth and development. Complications is if left untreated, VSD can lead to heart failure, pulmonary hypertension, arrhythmias, or endocarditis. Treatment approach can usually depend on the size and symptoms that are being present, but often we want to monitor or medication, or there could be surgical repair. Long-term outlook. With appropriate treatment, most infants with VSD can lead healthy lives. So I hope you enjoyed this episode. Save it for later. This is a good one to know.